my name is Schairer, PhD. I'm a clinical psychologist here at Freedom Within. So the reason I first decided that I should pursue being a therapist was primarily because my friends kept telling me when I was making decisions in college about what major I should do. They said, you should do psychology because you're the kind of person who everyone wants to talk to when they have a problem. So I said, okay, I'll go ahead and do that. And as I started in the field, I decided it was perfect for me and just kept going. And one reason I decided to specifically work with the military and veteran population is because my sister is an OIF veteran, and just watching her go through that whole experience of being deployed in war, coming home, seeing all the effects of her and her friends who went through it, just really made me passionate about wanting to help those people. So I primarily see adult individuals who often come to me because they're either struggling with past traumas in their life or because they have generalized anxiety or depression, or they're just going through something really, really rough and they just want some help getting through that. And I also have a specialty in working with people who have chronic medical illnesses, and I was trained as a health psychologist for that reason. So the way I like to approach therapy is I like it to feel like we're a team. You know, I may have the book knowledge, but you know yourself and you are an expert on yourself. So how I like to work is I like you to come on in and we figure out how to work together, and you kind of tell me what you need, and then I throw all the book stuff on top of it, and there we go. So my goal for the client is really to be able to figure out what you value in your life and to help you work towards living that every day as best as possible. So I primarily work from a cognitive behavioral perspective, and I try and integrate multiple other evidence-based therapies within that. So that includes dialectical behavior therapy and acceptance and commitment therapy, also known as ACT. And I also work from a trauma lens, and I use multiple specific trauma therapies for that. So I'm trained in prolonged exposure and also in cognitive processing therapy, as well as narrative exposure therapy. And in terms of the specific cognitive behavioral therapies that I use, I'm specifically trained in CBT for insomnia, CBT for chronic pain, and CBT for anxiety and depression. When I'm not in the office, I am mostly hanging out with my family. I have a wonderful husband, and I have 2 kids, a 5-year-old son and a 1.5-year-old daughter. And I also have a little white short-haired cat named Posey, who sometimes makes therapy appearances in telehealth. And we spend our time hanging out outside. We go to the beach, we go to the park, and we just love to play and go on adventures. If you feel that I would be a good fit for you, I would be honored to go on this journey with you.